Um, okay, I think I got it now. Mpacho mote me can still.
Yes.
Mpacha yeto nka.
Okay, me da it. And then so Nyankopon adom Andra Dr. Yeboah and yen go through and normal me about sleep and this and ho here. Nyankopon adom and the onam ne so no or one of our own. Send of Bronx Asafo Nyankopon ache so many talents, and when it comes to health, they are go for me very knowledgeable. And the Nyankopon nam ne so a obekasa ache yen fa ya pomode ho no. Ya nua ye ba ye nana ye rich auntie Dr. Sarah Pepra or ye OBGYN nti no eba emma pomodin dia yenim say or ye very knowledgeable. Nti say communication for ebo ye theme song no emma yen wia eni a ye bete no ye Dr. Sarah Pepra nyame nka ye nyina ye ho amen.
Odojefu kesina ben oni trimo bro Jesu okasama kuma tojem odofutie Jesu ni Joma ejede wasro dina ejede waha niji juma watupen Jesus shafu Jesus Nyonyam kagwa mahoriwun enemiji Yesu di mido hajin kwa panudin mido mi Yesu di no Joma ejede wasro dina ejede waha niji juma watupen Yesu shrafu Yesu Nidin pama fobunihu din binti se Jesu di omikra kondo se eti Jesu dina esumbun Juma ejede wasro dina ejede waha niji juma watupen Jesus shrafu Jesus Chelbeba nyonyam ninkwa hinchelno dano jebe tra ninchen akajen kwa jihunse Juma ejede wasro dina ejede mawatopen Yesu shrafu Yesu Joma hejebe wasro Dina hejebe waha Niji joma watopen Yesu shrafu Yesu.
Amen. I would like to thank Sister Priscilla this evening for introducing me, and to thank the Health Ministries Department at North Bronx, Ghana, SDA Church, for inviting me here this evening to share with you our health topic. As you know, our theme for this week is Your Health is Your Wealth. And indeed, the knowledge that we've gained and will gain from this week's programming is invaluable. It is worth so much more besides just actual dollars and cents, because it is literally about your life. Yesterday, we've learned from our very own Dr. Yeboah about how sleep is very important. And honestly, I took so much from that, and I realized that we need to work more on our sleep. Today, I will be sharing with you a topic specifically geared towards women, because my background is OBGYN, and so I deal with women's health. But I do think it is still applicable to both men and women, because if you don't have a sister, if you don't have a niece, or if you don't have an auntie, you at least have a mother. And so whatever you learn today, it might help, if not you, it might help somebody that you love in your life. And so before we begin, I want to take this time to thank the department leadership for allowing me to come before you to speak today. I want to set the precedence that it is true that I speak sometimes quickly, so I'll take my time to speak slowly, and that this is a space where you can ask any questions. And if you have some questions that you don't feel comfortable with at the end, you can always message me either privately, or you can even text me at the end. And even though I'm going to talk specifically about one particular topic, I am open and available to talking about women's health in general. So before we continue, I'm going to just ask us all to bow our heads and close our eyes for a quick word of prayer. Lord, this evening, your flock, your people, we gather this evening to share knowledge and to share wisdom so that we may not perish. Father, we ask you to help us to learn this evening how we may live our lives in a healthier way, and so that we may pay attention to the cues from our bodies. We may exercise our bodies, exercise our thoughts, and exercise being better Christians in every situation, in every manner, so that we may be fit and ready for your service here on this earth as we anticipate your soon coming. And so this evening, I ask you to bless each and every one of us here today. Let us take a word from my message, but let it not be my message, but rather yours. And bless us, Father, and help us to lead healthier lives. This is our prayer this evening through your Son, Jesus Christ's name we pray. Amen. And so I'm just going to take this time to share my presentation with you. Give me 1 minute. I'm going to see if I can pull this up. Sorry. Okay. All right. So here and here we go. Okay. All right. So let me make this full screen. Oh, sorry. One second. View slideshow. Okay, there we go. So the topic I'm talking about today is entitled Normal and Abnormal Uterine Bleeding, period. So this topic is all about your period. And if you don't take anything else from this, is that I want you to know what women is considered a normal period, and when it's more importantly considered an abnormal period. So if you do feel that you fall into the category of having an abnormal period, that you don't ignore it, but you seek help. So just as a brief introduction, this topic does come out of my topic from about 3 weeks ago when we went to the women's retreat, where I talked about general health questions that people may have when they visit their OBGYN. One of the questions that we do ask or are asked a lot of is about your period. And so I just wanted to take this time to kind of address a lot of topics surrounding the period, because it does touch on a lot of different topics in OBGYN. And then at the end, go over what's considered abnormal bleeding. And so therefore we can have a discussion about it. Now, people will ask, why is talking about a period so important? Well, a period actually pretty much covers about a third to a quarter to a third of a woman's life. And so it is a major part of their life. And in fact, a lot of the reasons why people seek an OBGYN doctor, it's because their periods or they're feeling like their period is not normal. And I like to tell my patients that you can consider your period as another vital sign. When we talk about vital signs, we talk about our blood pressure, we talk about our heart rate, we talk about our weight, we talk about our oxygenation, saturation. But a lot of times we don't realize that there are other cues in our body that can point towards our state of health. And so I want to bring to your attention, as women, us being half the population, a major vital sign that we can use to know and assess our state of health, and therefore address it if we notice that our periods are out of whack. So just in general, just to give some background, what a period is, or your menses, is that each month your uterine lining will shed and you'll have bleeding. And usually that bleeding lasts anywhere from 1 to 7 days, and that's considered normal. This bleeding is how your uterus cleans out the inside, and then eventually it'll build up again and it prepare itself so that if you do get inseminated, or if an egg meets a sperm, that it generates a lining inside the uterus to support that pregnancy. But if there's no egg that implants into the uterus, that generated new lining sheds, and that's what's your period. So it's just the normal shedding of the inside lining because a woman did not get pregnant. The average age for a person to start their periods is between ages 11 to 12, but some people can get their periods earlier and it be considered normal. And in fact, it's probably because a matter of what the American diet is that the age at which young children are getting their periods is actually moving earlier and earlier. 10 or 15 years ago, or even 20 years ago, most women, or young girls, I should say, would start their period usually around ages 9, 10, or 11, and that's considered normal. Now we're getting children as young as 7 or 8 who are getting their periods. Now, it's considered abnormal if you get your period at age 7 or earlier, and we can talk about that in more detail. But generally speaking, when you first get your period, usually around ages 11 or 12, that's when your period starts, but it can be a little bit irregular, especially for the first 2 years. So it can take up to 1 to 2 years for your body's hormones to get into a cycle. But typically speaking, a period cycle is anywhere from every 21 days or 3 weeks to every 35 days or 5 weeks at a time. And it can fluctuate somewhere between there. It doesn't have to always be exactly every 21 days or exactly every 30 days, but usually within that range, that's normal. And the total amount of bleeding or the shedding over the course of that period is about 80 milliliters. So it's not that much, but some people can have heavier bleeding. And so what does your period say about your health? Well, it actually can say a lot, because the way your period works, it's a function of the hormones in your body. God is so amazing in that He created this way of the various hormones in your body leading to another change in the hormones in your body, leading to another change, and it's a whole cascade that leads to eventually a cycle in which you shed your lining, you ovulate, you build your lining again. If you don't get pregnant, the whole cycle starts over and over again. So in fact, your period can tell you about your hormonal health of your body. This diagram you don't really have to pay attention to. It just describes the hormones that normally fluctuate through your cycle. And on average, we use a 28-day cycle because most people are somewhere between there. In general, most people's periods are pretty consistent in the quote unquote follicular phase. So that's the first 14 days usually of a person's period. So that's when you have a couple of days of bleeding and then your uterus starts building up the lining. And then when you ovulate, that period from that ovulation to when you actually build up your lining and then shed can be variable. And so that's why some people can have variable periods. But generally speaking, this first 14 days is pretty consistent with everybody. And this tends to matter more in people who are trying to get pregnant, because we tell them to try to get pregnant on certain days if they have trouble getting pregnant. But I'll talk about that more in a second. But in general, a normal period, like I said, anywhere from every 1 to 7 days, as long as it comes every 3 weeks up to every 5 weeks, that's considered normal, and no bleeding in between your periods. But there are normal variations of periods, and it could be still normal. So for instance, if you're taking medication such as birth control, your periods might change in its pattern, but still be considered normal, especially if you take medicines like birth control, such as the Depo-Provera, which is an injection you get every 3 months, and your periods tend to get lighter or even go away altogether. And that's okay. You don't have to have a period every month when you're on medication, because we know that the cause of your pattern being different is because of you being on the the birth control medications, and that's okay. Some people have this mentality that they have to see their period every month in order to be healthy. And in a situation of you being on birth control, that's not necessarily the case. In fact, sometimes we put people on birth control to either make their periods lighter, space it out, or be more regular, or even go away altogether, or be infrequent, like every 3 months, because of the fact that those patients may be having abnormal bleeding. And so in those settings, when you have periods that are kind of quote unquote not regular, when it's actually because of birth control, it's still considered normal. So just keep in mind, birth control can make it normal for you to not have your period, and that's okay. You do not have to have a period in this situation to be considered normal. And you don't have to worry about birth control affecting your future fertility, because the whole point of these birth control methods is that they are reversible. They are so reversible, in fact, that especially for birth control pills, which is up here, that if you miss a pill, you can get pregnant right away, which is why we tell patients to be really diligent about taking their pill at the same time every day. They're that reversible that if you stop it, your fertility comes back. Certain other forms of birth control, such as an IUD, it's placed inside your uterus. When you have a provider remove it, you get your fertility right away. Other forms of birth control, such as the Depo-Provera, that's an injection that you get every 3 months. You have to wait for the full 3 months for it to be out of your system before you resume your normal cycle. Other things that can cause you to have no periods, of course, is pregnancy. So when you're pregnant, you don't have your period, but you're still considered healthy, and that's okay. So for women who are of reproductive age, and that's what we considered anywhere from your teens to your 40s, if you don't have a period and you miss your period for a month, the first thing you should do is take a pregnancy test, because that's the most common reason for not having a period. There are other reasons for not having a period or having irregular periods, such as PCOS, which is polycystic ovarian syndrome, which I can talk about more later if somebody's more interested. But in general, you can have irregular periods because of polycystic ovarian syndrome, or PCOS. And it doesn't mean that you won't get pregnant, but some people can have difficulty with their fertility and have infertility issues with PCOS. And so Their periods might be irregular from that, but sometimes even losing as much as 10 to 15 pounds alone can regulate your periods and reset you without the use of any medications and improve your fertility just from that. So you can see how important your period is. Knowing what your normal period is and what's an abnormal period can actually really reflect the state of your health, because not only can it be related to your fertility, but it can also relate to your hormonal balance of your body. Polycystic ovarian syndrome in general is a diagnosis that really describes a set of known symptoms that occur when certain hormones are out of balance. So those hormones could be your thyroid hormone, it could be your prolactin hormone, which causes you to have produce milk. It could be even things like caused from stress. Sometimes if stress is prolonged, you can have, and especially if it's acute, very strong stress, it can make your periods irregular. Or it can be even a reflection of diabetes, because studies have shown that PCOS, which is associated with irregular periods, and diabetes are related with each other. And diabetes is actually a hormonal dysfunction or endocrine disorder. And so knowing that you have regular periods can actually be a reflection of you having a normal hormonal balance. Other things that can be associated with your periods and still be considered normal is what we call premenstrual symptom, or PMS. And PMS is when some people have like that bloating feeling. They might feel a little bit down. They might have some tenderness of their breasts during that time period. And that can be normal. And it typically will resolve when they get their period. But a more extreme form of PMS, which is premenstrual dysphoric disorder, that's associated with extreme feelings of anxiety, depression. Some people can even get, unfortunately, suicidal during this time. And we know it's premenstrual dysphoric disorder, because when their period comes, it resolves. So typically a week or so leading up to their period, they get these really, really bad symptoms, the cramping, the pain, the irritability. But during this time, they can also get increased mood disorders, the depression, the anxiety, the thoughts of feeling worthless. And then when their period comes, miraculously, they feel better. And sometimes this can be a genetic component. Some people are just more predisposed to getting PMS or PMDD. Some people have a history of depression and anxiety, and therefore they're at increased risk for having PMDD. And some people, we just don't know the reason why. Stress could cause it, smoking could contribute to it, but it is something that is essentially relieved with your period. And so if you're somebody who suffers from PMS or PMDD, know that there is treatment for it, but it is just a reflection of the normal cycle of the hormones in your body. And then we get to a big topic that a lot of people always have questions about: menopause. What is menopause? Am I normal? Is the menopause the cause for all these things that I'm going through? So just to define what menopause is when you don't have a period for a full year. As you're leading up to your menopause, you can have bleeding that you might consider abnormal, but it's actually considered normal in that perimenopausal period. The average age for menopause is around 51 years old. Some people go into it sooner, some people go into it later. Some people may have the symptoms of menopause either before the menopause, during the menopause, or even a couple years, or even for the lifetime after the menopause. Those symptoms include some vaginal dryness, hot flashes, headaches, sleeping problems, night sweats, mood changes, weight changes, slowed metabolism, memory problems. Sometimes that can be attributed to menopause. And I get a lot of women who ask me, is this because of menopause? Well, it may be, but there are a lot of other causes for these symptoms, especially the memory problems or the weight gain problems. And so I always recommend that you do a full workup before you attribute those causes of the symptoms to menopause. But again, normal perimenopausal, so that means around the menopause. So before you become menopausal, you're premenopausal or perimenopausal, your bleeding can get lighter and it can skip months, and that's okay. In fact, that's normal because it's not like you go from one day where you just have a period and then you just don't have a period. No, your hormones go through cycles and they are in flux. So for most people, their menopause becomes noticeable sometime around ages 45 to 50, 51, where they start to notice, I'm skipping a period. Okay, that's normal. Yes, you can take a pregnancy test to rule out pregnancy, but typically speaking, if you start skipping periods around this time, it is considered normal. So we talked about normal periods. What's considered abnormal bleeding or abnormal periods? So abnormal bleeding is if you're bleeding for longer than 7 days at a time. If your bleeding occurs more frequently than every 3 weeks, so like if you see your period every 2 weeks or more, that's not normal. Or if you're having bleeding in between your periods, so like let's say your period, you have a normal bleeding at the beginning of the month, and then you notice some like light bleeding or spotting in between in the middle of the month, and then you have a normal full period again, that's considered abnormal. Or if your periods become heavier. So before, you only needed like maybe a couple pads, maybe 4 or 5 pads a day, and it would be fine. But now you're needing like 7, 8, 9, 10 pads, and it's changed. You have to change it all the time. That's considered abnormal bleeding. In terms of possible causes for abnormal bleeding, for the most part, God being so good, most of those causes are benign, which means that they won't be life-threatening to you in terms of things like cancer, but they can still be life-threatening in the sense that if you have a lot of bleeding, it can be deadly to you. So you know how I said earlier, the normal amount of bleeding most women have is about 80 milliliters. That's not a lot of bleeding. But some people can be bleeding to the point where they actually like become very anemic, which means they have low blood count, and they might even need medications like iron or even blood transfusions to replace that bleeding. A lot of the times, the cause for the abnormal bleeding is benign reasons like polyps. So you can have uterine polyps, like here. Adenomyosis is just a condition where the uterine lining invades the uterus and makes it kind of like a sponge that can't contract, so it bleeds easier. You can have fibroids that cause you to bleed because it's like a solid body that is preventing your uterus from contracting as much, but it's not all fibroids that cause you to have heavy bleeding. It's just certain kinds of fibroids. You can have irregular hormones, and that could lead you to have abnormal bleeding because of the irregular pattern and cycling of your periods. You can have inflammation inside your uterine lining. So some people who've had infections in the past, and not necessarily STD infections, but infections in general of the uterine lining, their uterine lining is more irritable and therefore it bleeds more. Other reasons could be because of you having been on birth control. Certain birth control, it's a known side effect that you might have like a little bit of spotting or sometimes even heavier bleeding. That's more commonly seen in the birth control called Paragard. That's a hormone-free birth control. Your period tends to be the same, but for some people it can be heavier. And so we call that kind of bleeding, it's caused because of the fact that you have a Paragard or a birth control in place. But there's always the risk that there could be abnormal causes for the bleeding that's attributed to scarier things such as cancer or precancerous lesions, which means that you have abnormal cells in your body, inside, in particular, your uterus, that causes you to bleed more. But even aside from cancer, some people can bleed to the point that it's life-threatening, like I said, and need to have a blood transfusion for it. And a lot of times you can treat those issues by treating the cause of the bleeding. One of those main causes for bleeding is fibroids. So I like to say that fibroids, people get really concerned when they hear fibroids, but it's pretty common. 70% of women walking around have fibroids, and a lot of women don't know that they have fibroids because a lot of fibroids typically are small. But sometimes if you have larger fibroids, or if they're located more towards the inside lining of your uterus, like here, we call them submucosal fibroids, those tend to cause heavier bleeding. Some fibroids, if they're bigger, and depending on where they are, they can cause you to have a fuller belly or bloating in your stomach. Excuse me. They can cause you to have pain sometimes during sex or just in general. And sometimes if they are located in places that could be like cause you to have difficulty with peeing or cause you to have difficulty with pooping, or they can even cause some of them fertility problems. The ones that tend to cause fertility problems tend to be the ones more towards the inside lining of the uterus, called the submucosal fibroids. Typically, a lot of people have like intramural, which means fibroids inside the middle, or subserosal, which means fibroids on the outside, which tend not to really affect your fertility, but the ones on the inside can sometimes affect your fertility. And for a lot of people, treating the fibroids will treat the heavy bleeding. But in general, what should you do if you're concerned that you have heavy bleeding? First off, make sure you keep a calendar of your periods to track your periods. I like to keep my period calendar in my phone app. I use the calendar app, but there's a lot of period apps available that you can use to keep track of your periods. So if you notice that your period is starting to become abnormal and it's lasting for 3 months or more, you should go see your doctor. If you're at the reproductive age, you should do a pregnancy test first, because sometimes you can have bleeding and it be because you're pregnant. Next, if you're somebody who's menopausal, so you've gone a full year without bleeding, and then you suddenly start getting your periods again, that's something to notify your doctor for. A lot of the times people can be postmenopausal and have bleeding and it be benign reasons, because sometimes the inside lining of the uterus gets very thin. We call it atrophic endometrium, and it causes a little bit of irritation on the inner lining and it bleeds a little bit. So a lot of the times when you're postmenopausal, the bleeding can be normal, but there is an increased risk for cancer in that setting. And so if you're somebody who's gone a full year without your period, and then all of a sudden you start seeing bleeding from your vagina, don't sit on it, go see your doctor. And when you go to see your doctor, the things that they will do is at baseline, they will order an ultrasound. So this is just a demonstration of the ultrasound where they put a probe to look inside to assess your uterus, your ovaries, fallopian tube, and just basically the inside of your belly. And they might also do some sort of biopsy called an endometrial biopsy. This biopsy is where they take a straw and they go inside your uterus to see if there's any abnormal cells. And the reason why we do this is because a lot of the times, again, the cause for abnormal bleeding is benign reasons like polyps or fibroids, or because of ovulatory dysfunction or hormonal imbalances, but there's always the rare chance that it could be because of cancer. And so that's why they would do the biopsy to see if there's any cells. An alternative to doing that biopsy, which is done in the office, is a hysteroscopy, which is done in the OR. Basically, we put you to sleep and take a camera, look inside your uterus, inflate your uterus with water, and take pictures to see if we see anything. And if we see the polyp, we remove that polyp at that time. But there are medicines that we can do to treat abnormal bleeding, and even medicines that are non-hormonal. So starting off, if you have like some abnormal bleeding and it's because of like fibroids, one of the things you can do is take ibuprofen or Tylenol. Especially for people who tend to have particularly painful periods, you can take it at least like 2 or 3 days before your period. You know, obviously take ibuprofen or naproxen with meals. You don't want to take it on an empty stomach, but that sometimes can help you with decreasing the pain during your period and decreasing the heavy bleeding associated with your period if you tend to have heavy bleeding. For those of you who are anemic, taking iron pills can be helpful to help you rebuild your blood levels as well and correct the anemia. But the gold standard for treating people who have painful periods, which is called dysmenorrhea, or heavy periods, which is called menorrhagia, is really birth control. And there are various forms of birth control, but it's the birth control the ones with hormones in it. So those hormones like the birth control pills, or the IUD, which has hormones in it called the Mirena, or depot injections, or even the implant that goes in your arm called the Nexplanon. Those help to thin out your uterine lining and make your uterus less inflamed, for lack of a better word. A common misconception is that birth control will make me get cancer, or birth control will make my fibroids go. In fact, in general, for fibroids, We don't know why some people get fibroids, but in general, some hormonal medications like the birth control um, pills or birth control form, or even another type of hormone medication called Lupron can sometimes help to shrink fibroids within reason, depending on the size, and they don't make them grow. Another thing is that, is it going to cause you to have cancer? Well, no. In short, birth control is given to people, and studies have shown that it can actually decrease your risk for ovarian cancer and uterine cancer as well. But in the situation of people who have breast cancer or certain kinds of cancers that are sensitive to estrogen and progesterone, such as some uterine cancers, then we do not prescribe them birth control pills because it will stimulate what's there, but it's not going to cause you to get cancer. So I know that a lot of people are worried or concerned about birth control causing me to get cancer. It's not going to do that. And in fact, there are some women who go into early or premature menopause that we actually recommend that they have hormonal supplement because it helps to decrease your risk for heart attack and it helps protect your bones as well. And so birth control pills can be prescribed, or birth control in general can be prescribed, and not just for birth control reasons, but it can help protect your uterus and decrease your risk for certain kinds of cancers. It can help decrease the risk for heavy bleeding, and it can help decrease the risk for painful periods as well. So it's actually a pretty good medication that I think a lot of people have hesitancy in using, but unnecessarily so. And lastly, another medication to help with the bleeding, especially if you have heavy bleeding, is tranexamic acid. And basically, it's a medicine that helps you clot and therefore bleed less. There are surgeries that can be done for heavy bleeding, things like hysterectomy, which means removal of your uterus, and there's various forms of that. There's a myomectomy, which is the removal of, if it's a fibroid that's causing it, the offending fibroid, and there's various ways of doing that. Then for some people, if you're done with having children, you can consider an endometrial ablation, and that's basically where we burn the inside lining of your uterus, and that helps to decrease bleeding, and most people find a lot of success with that. And then there's also the uterine artery embolization or uterine fibroid embolization. And basically that's where they take a camera, go through your groin, go through your aorta, get to the artery that feeds the fibroid and burn off the artery. And therefore, by burning off that artery, you decrease the blood supply to that fibroid and it shrinks. So there are a lot of treatments for fibroids and for abnormal bleeding in general. But the main thing I want people to take from this talk is that don't ignore abnormal bleeding patterns. I think it's a healthy idea for every woman to keep track of their periods, just so they know when things start to go awry, that they have some information that they can look back and say, my period started becoming abnormal here. What happened at that time? Was I under a lot of stress? Because stress can sometimes delay your period. In fact, a study about China, I believe it was during the Great Famine in the 1980s. During that time, a lot of women lost a lot of weight, and because of the stress of being hungry, because of the famine, they actually were not able to get pregnant during those times because they didn't have periods. And it makes sense because when you have a period, it is wasting your resources. And so during those times of famine, you want to conserve those resources. So that's why you wouldn't have a period. So, there can be benign reasons for you to not have a regular period, but there can be also other reasons that are not cancer, but are concerning, such as like having risk factors for diabetes. Being overweight is one of the things that can help make your periods abnormal. And so if you can lose weight, even just 10 or 15 pounds can sometimes make your periods normal without medicine. But if you do have abnormal periods, don't ignore it. And medicines can be helpful in treating your abnormal periods, whether it's because it's heavy or because it's painful, or if you need surgery, surgery can help with it. And so keep in mind, though, that there can be normal, abnormal reasons for your period. So if you're pregnant, that's the first normal, abnormal reason. So if your periods are irregular, take a pregnancy test. But if you're on birth control, that's also okay to have abnormal periods as well. But if your periods are abnormal, and in fact, if you're having bleeding, vaginal bleeding, and you've been menopausal, don't ignore that especially. Or if you're overweight, or I know as SDAs, most of us don't smoke, or none of us smokes, but some people do. If you're a smoker and you have abnormal bleeding, do not sit on it because you have increased risk for abnormal cells or cancer. So in summary, I hope everybody takes from this that keep your period because it is a vital sign. It's a reflection of your health. And so if you have abnormal periods, please do not ignore it and seek care for it. Otherwise, I'll open the floor now for any questions and contributions. I believe we have about 10, 12 minutes for this. And so I'll leave it to the moderator to handle with the questions and fielding of the people who raise their hands.
Okay, Dr. Sarah, yɛda bebree nyame nhyira wo. Nti saa mmere no, adɔfo akwanya aba sɛ yɛbɛtumi de yɛ questions ne yɛ contributions aba. So far, sɛ wontumi mbusa wo question a wobɛtumi atype wɔ comment section na yɛbɛreadi ama wo. Nti Chanel, mpatwa wobɛtumi ama wo question or contribution.
Okay, hello, Sarah, can you hear me?
Yes, I can hear you, Chanel.
Okay, thank you so much for the presentation. So I have a friend, right, who believes that having your menstrual cycle, you need to have it around the same, like the same day every month. Because it was mentioned that usually with one's period, right, that person will get it like, let's say today's the 21st, they will get it. They have it the 21st this month, right? And then November, they have it 4 days before the 21st of, and that's just been a pattern every month. Would you consider that abnormal, or that's actually normal, as long as it's between that 14 or 21 8 days you was talking about?
Yeah, no, as long as it's between that 21 to 35 days, or every 3 weeks to every 5 weeks, that's normal because your body is in flux. There's always a lot of different things going on. So that's why we have that general time frame. Okay. So for some people, their periods are pretty much on the dot, like every 14th, I'm going to have my period. Right. But for some people, it's not as regular, but as long as it's like in between that 21 days to 35 days, that's considered normal. Okay. And sometimes, you know, if it's not pregnancy related, you know, sometimes it could be stress. So sometimes people may skip a month of their period and they might start freaking out because they think, oh, it's, you know, something's going on. But no, usually if it's not a continuous pattern for 3 months or more, then it's just attributed to stress or to weight changes. So yeah, it sounds completely normal, Chanel.
Right. Thank you, Sarah.
You're welcome.
For sure, question be about chat name. I said, please, is it normal to have your period twice a month?
So it depends, because some people will have their period at the beginning of the month and then at the end of the month, and that's normal because presumably there's at least 21 days from the beginning to the end of the period, from the end of the month, from the first period to the next period. But like I said, some people can have their period, and if it's like every 2 weeks, then that's not normal. That's considered too frequent. So, you know, you can have a period. Some people's period cycles are 28 days. And you can imagine in like November has 30 days. They could have their period on the 1st of November and then again on November 28th. And that still be normal because there's 28 days between it. But if they have their period on the 1st of November and then again on the 14th of November, then that's not normal. And that would be a reason to keep track of it. But again, sometimes you can have, so sometimes you can have spotting in between your periods, and that's not considered a full period. So spotting is like light vaginal bleeding. So sometimes people can see that. A lot of times that can also be normal because sometimes people are on birth control pills, or they might have ovule implantation spotting, for lack of a better word, but sometimes it could be a sign of something else. So, you know, we differentiate between periods and spotting. And so some people, if you're not in the medical field, you won't differentiate between that. So it just depends.
Okay. Thank you so much. Patricia, Obi question, say, what advice do you have for Obi to birth control pill? So I'll feel say a cause not to gain a lot of weight into your person free so no. Advice Ben I'll be a woman ni pebisa.
Yes, I get that question so many times during the day. In general, birth control, and again, it depends on the birth control, but in general, birth control doesn't cause any weight changes. There have been studies that show that it causes no net change in your weight. And in particular, if it's non-hormonal birth control, such as a Paragard IUD, has no hormones in it, it's not going to affect your weight. Other forms of birth control, like birth control pills, are not really going to affect your weight as well. The depot injection is the exception in the sense that the depot injection can sometimes cause people to be more hungry, increase their appetite, and therefore people gain weight on that. But not all the time, but some people. But a lot of people, if they pay attention to what they're eating, then they're not going to gain weight. And a lot of times people are complaining of weight gain, but they're not living an active life, or they're not exercising regularly, they're not eating correctly. And so they're going to gain weight and they're going to want to blame the birth control for it. But in actuality, it was their lifestyle. But if I like to put it in plain terms, if you're somebody who's at reproductive age, so you can get pregnant, if you compare the risk of getting pregnant and the weight gain associated with pregnancy compared to the lack of weight gain associated with birth control, which is more likely to cause you to gain more weight? And so I always tell people, like, you know, compare the risk of gaining weight with pregnancy. Honestly, you're better off being on the birth control pill and looking at your lifestyle and looking to see, are you going to the gym? Are you exercising regularly? Or are you living a sedentary lifestyle and eating poorly? So that's what the advice I would give to somebody on birth control and they have concern for weight.
Okay, yeah, that's it. Question back about chatting. Is it normal to have small clots during your period?
Yes, it's considered normal. So, so in terms of like what a normal period will look like, so like I said, if you're using like a couple of pads a day, that's okay. You might have some small clots during your period, and that's okay. It's just the way your body, when you bleed, it sometimes collects in your vagina and then it just comes out in like small balls. What's considered abnormal is like heavy or bigger clots. So like if you start having clots the size of your fist, then that's more concerning because that is usually indicative of heavy bleeding. Or if you start to soak through a pad an hour for 2 hours more consecutively, then that's an abnormal amount of bleeding at a time. So it just depends. Like small blood clots during your period, that's normal. Some people will even pass a little bit of tissue. And they get concerned or they start worrying, but that's usually normal. It's just the inside lining of your uterus shedding. But if you're having clots the size of your fist or larger, that's more concerning.
Okay. Ebisa for Pachoya, that's all.
I see a question. Oh, okay.
Oh, okay. So when does menopausal period ends and when does postmenopausal period starts?
Okay. So postmenopause. So there's no real, okay. So we call women postmenopausal when they've entered into menopause. And menopause essentially is for the rest of their life. But there can be degree of the symptoms. So some symptoms for some people, the hot flashes, the night sweats, the mood swings, or the vaginal dryness, not so much the vaginal dryness, but the previous symptoms, they can last for a couple of months. Some people may not get them at all, but for some people, it can last the rest of their life, unfortunately. It tends to be that for most people, it tends to get better over the next couple of months. So or next couple of years. So usually they'll go into menopause around 51. And for a couple of years, more towards like the beginning of their menopause, they'll feel the symptoms more acutely and more intensely. And so during that time, they would benefit from medications, or sometimes they don't need medications. And then it typically tends to get less intense as they move further out. But as for predicting when it will stop, everybody is different. And for some people, it can be years. So there are some women who need to be on things like hormone replacement therapy or medicines for their hot flashes for years. And that's okay. And there are some women who don't even experience any of those symptoms. For them, their menopause is easy and they don't have any symptoms. So it just depends.
Thank you so much. And Patricia, you could suggest questions, contributions, or concerns be ultimate.
Oh,
Yeah, go
I
ahead.
see. Yeah.
Patricia, wait me. Can you talk about PCOS?
Yeah, PCOS is kind of a broad topic, but in summary, PCOS stands for polycystic ovarian syndrome. And basically it describes people who either have irregular periods, so their periods are they come every 36 days or more, so it's infrequent. They have increased hairiness, or signs of hirsutism is what they call it. So they have like facial hair, or they have male pattern hair, or they have signs of increased testosterone in your body, which will reflect with the hirsutism. And they have cysts on their ovaries, which is what called polycystic ovarian syndrome. And you can have 2 out of those 3 things that meet criteria for PCOS. But PCOS describes a collection of symptoms, and PCOS can be caused from other things like diabetes, having thyroid problems, having prolactin problems, or sometimes we don't find the reason for PCOS. PCOS tends to be associated with fertility, but it can also be associated with increased risk for diabetes. And in general, the main treatment for PCOS is birth control to help regulate your periods. And people who have PCOS can still get pregnant. And so we do recommend that people who have PCOS, if they're not planning to be pregnant, to go on birth control. But a thing that they can do to decrease or increase their fertility is to have a normal weight. So if you can lose like 10 to 15 pounds if you have PCOS, then that can help with your fertility. So in summary, PCOS is a whole nother topic I can go into later, but that's kind of the general gist of it.
Yeah, that's it. Patricia, Obi said does early period, as in age, means early menopause. I think it says maybe a unya period at a very early age. Doesn't mean you're gonna have menopause at an early age as well. My name's a question. I said,
Nope, there's no relation. There's no relation.
yeah, that's it. Was there any advantages in having your period early in life?
Actually, no, it's a disadvantage. Because basically, if you have your period earlier in life, it can mean that you're at slightly increased risk for uterine cancer or abnormal cells. And if you think about it, because your period is a reflection of the estrogen levels in your body. And so the longer you're exposed to estrogen, which can also be because of abdominal fat as well, the earlier your period is or the later your period is, that means you've been exposed to estrogen longer. And so that can also be increasing your risk for certain kinds of uterine cancer. But estrogen also has its benefits as well. It's not all bad. You know, estrogen also helps to protect the bones and can be protective of your heart. So there are pluses and minuses to it. But in general, it's not the best idea to have an extremely early period.
Okay, thank you so much. I think so. Last question. We hear of fibroid in women a lot these days. Is it on the increase? If it is, what is causing the increase?
I'm not sure if it's on the increase. I would actually have to look back into that and do some research. I do know that more people are getting ultrasound imaging in general. So if more people are getting imaging, they're probably going to notice it more. And so I'm not sure if the incidence of it is more, or if we're just finding it more because we're looking at it more. But I mean, one of the studies, even though we don't know what causes fibroids in and of themselves, but studies have shown that, excess estrogen can be a contributing factor. So I can guess that because in America, generally speaking, the weight of Americans are increasing, and therefore a lot of problems associated with excess weight is increasing, that there might be a correlation, but I can't say that right now. But if I was to guess one of the reasons why people's fibroids are increasing, it might be because of people are more generally unhealthy and at bigger weights.
Okay, yeah, that's it. I'm gonna say will be so the final question of it. Hi, Dr. Sarah. Is it good to have your period earlier than your usual date? You have it on the 20th and get it on 15.
So, as I said it before, as long as it's within that period of every 21 days to every 35 days, then it's fine. Your periods can fluctuate within month to month, and that's okay. As long as it's between that period of 21 days from your last period to 35 days from your last period, then it's fine.
Okay. Yeah, that's a bit brave. I'm saying Hannah and Rebema the Yadisian SCNA. Yeah, the better Dr. Sarah, I'm sure it was a very wonderful presentation. Mijidi se mesia bibi na ya ye was oba obema onso wesia bibi. Yeah, de eba ewie no. Ebe sure say enyonyam kenyame obebo empire amayen after announcement na beba no. Nyame ya adoma yebesa atwa so ochina nipa awabedi ni mama yen no obi a yenta ante so kasa mebre nti metro so de wan kasa bra na fa we ni ba behwe na fa wasunsu ba beti field nso a yenta anka ho asemu mebre nkasa no bronze yakopon issue yen was so many disciplines ho nti ochina yakopon ya adoma 7:30 pepe na program no ahya ase anopa nso by 5 o'clock na saba school so koso nti ye shemo 5 a.m. na started. We were betting me no bet me I join it. Nti no enyonyam kenyame obeboy and closing prayer na mayen. Ye we are na communication for amayen your theme song ne bio. But my kata ye.
Pamcho ye bonfire.
Oh.
Enyame ne ye na bank sie. Omada wasi enumere. O adom ne ehumobro a waye umma. Asedane ayeye nka odini da. Enumere ubobo aya no eba wanim. Wama ya bete nsem a ebeboa ye wo yapomudene ho. Ne ebeboa ye mebunu ene ye ampa ye ko ye monoposo ye mu nyina. Ora na ase nka odini da. Yesro pa se ye betie nsem ya ma ye nye nsem ye tie ne saa kwa na emum. Ye mfemu aba na ye mfa mo ye ho bra. Eno ne beboa ma ye mpomuden no asisisu ye. Ama ye timi asom ogidie ene no kware mu. Enwumere ye de ye mba odi dwumadie ye nim ehye wonsa. Yesro ahoni biara a wo fere ye no moburu hunu nti yesro hyenanemu da. Na fe mani nimdi a de biara da obetimi agina na wakasa kire wo ma ama wo ma nso anyam ntiase na ye de aboye mbra awie bire mu. Yesre osuru nshira ema wo bai se boa no. Na fe mani nimdi mani nipa nim adom baby biara obegina no wankasa ye ne kasamafo na fe ye nyina ye mfa mo ye ho bra ye ne ye wala nso nyina nso ye de ye ho hye wonsa asem ya ye beti ye sere pa asem nsemi ntae mu se subra ye nwida de bia da ne ye mfa bi nsiesie ye ho na ye de bi nso asiesie afoforo anwumere ye koda o ye firi wanim ye bi kwa adwuma e bi nso firi adwuma mu ba fie ye de ye nyina ye ho hye wonsa se bo ye ho bai. Wana wo kono fa wonko wana wo ba nso fa wombra Yɛn a yɛbɛda nso yɛde yɛn nyinaa ho hyɛ wo nsa sɛ ma yɛn na ɛnyɛ yɛ de na ma abɔfo awɛmfo no mɛwɛn anadwo mu nyinara. Na sɛ wanɔpa han fɛfɛ no pie wɔ yɛn so a yɛasɔre a yɛde ayɛyie ne na ase a ɛni ka bi ama wo. Na yɛakasa yɛwɔ Awurade na wayɛ. Yɛda wase sɛ wobɛyɛ yɛ bambɔfoɔ anadwo mu yi mu akɔsi sɛ adeɛ bɛkye yɛn.